This video is going to cover 5 different drugs that can be used to target TNF-alpha. It'll take place on True North fields to remember the TNF and TNF-alpha. As a reminder for the naming conventions, we're going to start off with 4 different monoclonal antibodies, which will end in mab for monoclonal antibody. The ones that have an XI right before the mab are chimeric, and the ones that have a U before the mab are human. Most of these drugs can be used for about the same conditions, including rheumatoid arthritis, ankylosing spondylitis, psoriasis, and inflammatory bowel diseases, which makes sense because we are reducing the immune response, which is overactive in these conditions. The first one coming up is infliximab, represented by an infant golfing. Infliximab is especially potent and is given via IV, which makes it good for severe disease. After infliximab, we have a certified golfer to represent certolizumab. And the important thing about certolizumab is that it has a pegylated structure, reducing its ability to cross the placenta and making it good for treatment of pregnant women with rheumatoid arthritis and Crohn's disease. Another monoclonal antibody that we have coming up is adalimumab, represented by a Dalmatian, or ADAL. And the last monoclonal antibody that we're going to cover is golimumab, represented by golfing. And this has a long half-life, making it low maintenance. Lastly, we're going to mention something that is not a monoclonal antibody, but still targets TNF-alpha, and that is etanercept, represented by someone tanning. And then just to quickly cover the major side effects of these drugs, we notice a man standing with red butterflies around him to remind you of the red butterflies, like the butterfly rash in lupus for drug-induced lupus, as well as a granuloma in the lungs to remind you of the reactivation of infections, including TB. And that's everything we have about TNF-alpha blockers.